A very good morning to one and all. I, Dr. Eenal Bhambri, Professor, Department of Orthodontics and Dentofacial Orthopaedics at Surendera College and Research Institute, Ganganagar, would be speaking upon the topic space gaining in orthodontics. So the first question is, why do we need space in orthodontics, or what are the cases in which we require space? So the space is actually required to move the teeth into ideal locations, that is required to correct crowding. So whenever the teeth, they are malaligned, they are irregularly placed, we require space to correct them, we require space to align them. In patients in whom teeth, they are forwardly placed or they are proclined, we need space to retract them, we need space to bring them back into the arch. In patients in whom the teeth, they are extruded, in patients in whom the curve of spee, it is not flat, it is either more or it is exaggerated, in all those patients we require space to level the curve of spee. In patients in whom the anterior teeth, they are rotated and we need space to derotate them. Whenever the molar relation, it is not class 1, be it class 2 or class 3, we require space to correct that molar relationship. And this molar relation correction, it requires almost 5 millimeter of space on one side. So how much space is required? It varies from case to case. And what are the methods by which this space can be gained? So these methods, they can be classified under two broad headings, that is extraction and non-extraction methods. Non-extraction methods are expansion, interproximal reduction, which is also called as proximal slicing, proclination, molar distalization, uprighting. There are many methods which can create the space by non-extraction. Among them, we would be discussing proximal stripping today. So proximal stripping, as the term is suggesting, proximal means mesial or distal and stripping is removal. So we are removing something from the proximal surfaces. Now what is that removal? That is enamel removal. So proximal surfaces, they are sliced to reduce the mesodistal dimensions in cases with mild to moderate discrepancy. So whenever this discrepancy, it is in between 0 to 2.5 millimeter, we can correct that treatment. We can correct that patient crowding by proximal stripping. So the indications of this method, they include mild to moderate cases of crowding or 0 to 2.5 millimeter of tooth size arch length discrepancy. Whenever there is Bolton's excess, we can correct that by proximal stripping. And very important is, whenever the patient's profile is good, it is well balanced and we need to maintain the class 1 and canine and molar relationship, in all those patients, we can align the teeth, we can carry out the orthodontic procedure by proximal stripping. And the contraindications of this procedure include the young patients who have got high pulp chamber, the patients who have got high caries index, the patients who are not maintaining the proper oral hygiene, and the patients who have got enamel hypoplasia. All those patients, they cannot be treated by proximal stripping because this procedure itself, it is going to create roughened proximal surfaces. It is going to increase the chances of caries because of roughness, and all these things, they can lead to sensitivity in patient's mouth and alteration of the tooth morphology. So all these things, these are the disadvantages of this method, and this method, it can be carried out by two things, conventional or air rotor stripping. So the methods of proximal stripping, they include metallic abrasive strips. As you can see in the first picture, the strip is held in the air rotor and it is used intraorally. In the second picture, we can see the strip as well as the carborundum disc. So these discs, they come safe-sided or they come as double-sided also. We can use according to the patient situation. Another one more method by which we can carry out proximal stripping, that is the long thin tapered fissure burr. We can use the tapered fissure burr in the air rotor and then we can slice the enamel. Then the question is, how much enamel is to be removed? This is a very, very important thing because if we remove more of enamel, that can lead to patient sensitivity. The dentinal sensitivity can be introduced in the patient's mouth and that would be an iatrogenic problem. And so the question is how much we should remove in a patient's proximal surface. So the answer to this question is we should not be removing more than 50% of enamel thickness. And how to guess enamel thickness? That can be done by the help of IOPs. We can take the intraoral periapical radiographs, we can measure the enamel, and then we can reduce it by 50%. Or what we can do is we can use these incremental thickness gauges. These gauges, they come in various sizes, and then this we can put in patient's mouth in between the teeth, and then we can check that how much tooth surface is being reduced. So not more than 0.3 millimeter from each proximal surface can be reduced for orthodontic treatment. If we remove beyond this, we can introduce hypersensitivity in the patient's mouth. Then the third method of proximal stripping is air rotor stripping method. So as I told you, these thin tapered fissure burrs, these are the fine burrs which do not create much of fissures and grooves in the dentition. They can also be used for proximal stripping in orthodontics. So this was all about the proximal stripping, which is employed as a non-extraction method of space gaining. Thank you all for your patient listening.